Start right on time, mostly to get us politicians out of the way so people can hear from Dr. Avula and Dr. Varghese, who are the ones folks really want to hear from. Welcome to the Arlington Town Hall. Welcome you, along with my colleagues who will speak shortly, Delegates Hope, Sullivan, and Lopez, who I am honored to share the honor, the privilege of representing Arlington in the Virginia House of Delegates. The four of us are your four delegates. We all know how tremendously folks are concerned about vaccine and the rollout. All I have to do is tell you that I've been talking for 1 minute and there's 420 participants already in the room. This room has a Zoom limit of 500. If you cannot get in, please tell your friends you can watch at facebook.com/Levine for Virginia. You'll also be able to see the entire thing recorded. So if folks can't get in, you will be able to watch this. It looks like we're going to hit our 500 person limit. We're already at 440. I am Delegate Mark Levine. I represent Alexandria, Arlington, and Fairfax. Glad to provide you this information today. There's some tough truths, I think, that we all have to face, which is there's just not enough vaccine in the United States in general, and Virginia in particular, and Arlington in specific particular. But we're going to give you all the details and try to answer all your questions. And with that, why don't we go to Delegate Hope?
Hi, good afternoon, everyone. Thank you for joining this really important workshop or seminar. Hope to get through as many questions as we possibly can. This is just the beginning of the conversation. Just know that my office is always available to get responses to your questions. So we can give you all that information at the end. I won't trespass on the time. Look forward to the discussion and all the questions. Thanks for joining.
Delegate Sullivan.
Thank you, Mark. Good afternoon, everyone. I'm with Mark and Patrick, and Abel Alfonso agrees that we don't want to take up much time. I represent the 48th, as you folks know, which is a big part of Arlington and the McLean area of Fairfax. So there's some Fairfax County residents on as well, Drs. Varghese and Avula. So some questions will be coming from them as well. Thank you for being here. We all know what an important topic this is, and we all want to be part of the solution. So with that, I'll turn it over to Delegate Lopez.
Good afternoon, everybody. My name is Alfonso Lopez. I represent most of South Arlington and a little bit of Eastern Fairfax. And I can't thank you all enough for being here. We are, each of us are more than happy to answer any questions you have offline and provide constituent service, but also we are all, so concerned about making sure that folks get the vaccine as quickly as possible. And we're doing everything we can in our roles in the House of Delegates to support the governor, support the administration, and make sure that we're getting everything rolled out and set up and fix any issues as quickly as humanly possible. So thank you for being here, and we look forward to the conversation.
Thank you, Delegate Lopez. I was told we were limited to 500, but somehow there are 507 in the room. Again, please tell folks that if they can't get in the room, it'll be broadcast live on Facebook, on my Facebook page, facebook.com/Levine for Virginia, but we will have the entire archive version out for you in about 3 hours to share with whomever you like. Without further ado, the two gentlemen that are the stars of today's show are Dr. Ruben Varghese. He is the director of the Arlington Department of Health, and Dr. Danny Avula. He's the vaccine coordinator for the Virginia Department of Health. I call him Virginia's vaccine czar. And I think he's got maybe the most difficult job in Virginia, with Dr. Varghese being a close second. Most of the questions that came in were on the grounds of, when will I get my vaccine? Why were my vaccines canceled? I was registered at the Virginia Hospital Center. What's going on here? Why don't we have enough vaccine available? Who gets priority? All kinds of questions like that. I will ask those questions of Dr. Varghese in just a minute, but I do want to start with Dr. Avula, who's only going to be with us for another 10, 15 minutes or so, just to give us the overall view from Virginia in terms of how many vaccines Virginia is getting and doling out. Dr. Avula.
Yeah, thank you, Delegate Levine, and all the delegates who made this happen. I'm happy to kind of give a quick check-in on where things are at. So as of today, Virginia has received a total of just over 1 million doses of vaccine, 1,010,150. And you can find all of this on our public-facing dashboard at the VDH website. And as of this morning, we have 443,760 doses administered. So, that number has been jumping up by about 20 to 25,000 doses a day. And I think for most of Virginia, wondering why is there such a big gap? Why are there almost 600,000 doses that are unaccounted for? Has been a source of great confusion and frustration. And I think it is important for us to understand where that vaccine currently is, and is it sitting on a shelf somewhere waiting to be put into somebody and just not being administered well, or what? And the reality is that it's a far cry from that. And I don't know, I have time to do a deep dive, but there are at least about 100,000 doses that actually have been administered and have just not been entered into our state database. So there's always going to be a little bit of a lag between when doses get administered and when they show up. And then for various reasons, there's been some disconnects, and that's part of the work that we are committed to solving this week so that we can close that gap and more accurately explain to Virginians what's going on with vaccine. There are situations where large clinics did manual entry, and so they've got a bunch of paper records that they need to catch up on and get plugged into our state database. There are situations where health systems and other large providers used a platform that wasn't talking to our state database, and so there's software patches that are going on right now to make sure that we can get caught up and really accurately portray just how much vaccination has been done. But that accounts for a significant gap. The other piece is the long-term care pharmacy partnership. And so the federal government's plan to prioritize nursing homes and assisted living facilities through CVS and Walgreens, that right now 226,000 of our total million doses allotted are set aside for CVS and Walgreens to get through those nursing homes and assisted living facilities. Now, that doesn't mean that all of those doses have actually come in and been delivered to Virginia. Those doses have been set aside, but they are counting against our denominator right now. And so we are working with CVS and Walgreens to know exactly how much they've been distributed into Virginia and where the CDC is drawing their numbers from, so that we can get real clear about what's defining our denominator. But all that to say that, of the 226,000 doses that they have been allotted, right now they've got through about 60,000 residents of assisted living facilities and nursing homes. And so there's work that we can do immediately to start redistributing that vaccine, to get CVS and Walgreens to put it into their stores so that they can vaccinate the elderly population through that vehicle, or to reallocate to other pharmacies and partners who can get through our long-term care facility population more quickly. So we are meeting with them almost on a daily basis to define what is a next step. And so you'll hear more about that this week. And then lastly, there is a buffer, of doses that come in, they're delivered, and that they are scheduled for the upcoming week. And in some cases for the upcoming 2 weeks, many of our providers have received direct allocations of their second doses. And so those second doses are received, we're holding them in hand, but they are scheduled for specific individuals who need to make sure they get that second dose on that 3-week or 4-week interval based on Pfizer or Moderna. So there's a lot of nuance here, and I was looking at other websites over the course of this past week. New York in particular does a good job of breaking out first doses administered versus distributed versus second doses, and it just helps tell a more clear story of where vaccine is. And so that's some of the work that we've got to do to better communicate what is the status of current vaccine in Virginia. Now, the challenge we're facing this week, next week, and the weeks moving forward is that we only have 105,000 doses per week for the entire state. And so when you start to break that down by district, by locality, that's a few hundred, a couple thousand doses that are coming to every segment. As of this week, we are doing that on a per capita distribution. So 105,000 doses coming in, whatever the population is of Arlington, I would guess about maybe 2% of the total of the state's population. So there'll be an appropriate allotment, and I can actually look up what that is.
Dr. Villa, the 105,000, does that include first and second doses, or is that a double dose pack?
Great. So the 105,000 doses is just new doses. Now, what the federal government
only 50,000 people. for those 105,000?
Well, no. It's new first doses. Sorry about that. Yeah, new first doses. The second doses are being delivered on a concurrent schedule above and beyond that 105,000 doses. So, for example, this past week we got 105,000 new first doses, and then just around 61,000 second doses that were directly shipped to the providers who had done first doses 3 and 4 weeks before that.
So anyone who gets a first dose doesn't have to worry that they're going to get their second dose.
That's correct. Yeah, the allocation methodology is that if you get your first dose, then the same provider will receive second doses and should be scheduling appointments 3 and 4 weeks out, and they should be reassured that the federal government will get them that second dose allocation.
Now, there's been a lot of confusion. I'm going to get to Dr. Varghese in a minute, but I know you have to leave us. So I'm going to ask most of your questions to you first, Dr. Avula. There's been a lot of confusion about where you get it. Do you get it from your local health department? Do you go to Dr. Varghese to get it from the Arlington Department of Health? Do you go to your doctor? Do you go to the Virginia Hospital Center? Do you go to Walgreens? Do you go to CVS? Should you register in 12 places? Help us with where people should go to get the vaccine.
So that strategy looks different in every community, and we're really looking to our local health districts and sort of the regional efforts of local health directors to help define that for their community. So I'll give you an example of Lynchburg. Their health department has limited capacity based on their staff to do vaccination. So they are really doing more of a distributed model where they have brought pharmacies aboard and brought providers aboard. And so for the 1,000 to 2,000 doses that Lynchburg is going to get every week, the local health department helps define where it's going to go, what the allocation is going to look like, and then it gets direct shipped to those locations. And so again, I think here in the Northern Virginia area, looking to Dr. Varghese and Dr. Herring and Dr. Gloria will help kind of unpack where that has been allocated. And remember, this strategy is changing every week. Prior to 2 weeks ago, most of the vaccine was going to health systems, and there was more. There was more vaccine than people were requesting, but things have changed really rapidly in 2 weeks where that's totally flipped. So last week we had almost 300,000 requests for doses, but only 105,000 doses to distribute. This week it was even bigger a gap. And so I think the frustration of many providers who were receiving a lot of vaccine early on, I totally understand it because they scaled up. They were creating vehicles to get vaccine out at large scale to their communities. And then as vaccine supply really diminished, we've had to be a lot more targeted with our channels, because right now we have this double mandate to both vaccinate 65 and up and folks with underlying conditions, but also to work systematically through the essential personnel that are in that group 1B. And so every health department is working to create closed pods with their police, fire, hazmat, with their correctional facilities and homeless, with their teachers, K through 12, and childcare providers, and really trying to work through those essential worker tiers. And given that we're in 1A and 1B right now, that population is about 50% of Virginia. And so I think probably, I'll end here, that the thing that I want most people to realize is that 1B is a massive category. And when we're getting 105,000 doses a week, we're talking months before we're able to address folks who are in that 1B tier. And we've got to be a lot clearer from the state level about how we work through 1B so that our people don't have mismanaged expectations. Because right now, there's so many people who just feel like, why can't I figure this out? And we've got to do a better job of communicating that to the public.
So Dr. Villa, before I let you go, just some quick basic math. 1A is healthcare providers, basically. 1B was originally folks over 75, essential workers, and then 1C was people over 65 and people between 16 and 64 with health conditions. That population, you've told us in other examples, is 4 million people. There's 8.5 million people in Virginians. Half of Virginia is in 1B. Again, doing the math statewide, 4 million divided by 100,000 is about 40 weeks. 40 weeks is about 9 months. Starting in December, that takes August. Hearing that is going to depress a lot of people. What are the prospects for our vaccine rate increasing above the current 100,000 a week to 200,000, 300,000, 400,000 with either new vaccines or a better distribution system from the federal government? I hope we won't have to wait till August. What are the prospects for the future?
You and I both. So I think that the Biden administration has come in. They have pledged 100 million doses in the first 100 days. And I think there's two primary pathways that happens. First is by increasing production of Pfizer and Moderna, building the footprint, increasing the amount of doses that they're able to churn out every week. I don't know what the clear plan is, and it may be there. I just haven't been able to look at it in the last couple of weeks. But that's the first way. The second way is really with the introduction of new vaccines into the market. So both AstraZeneca and Johnson & Johnson are in the final stages of their clinical trials. AstraZeneca is being used in different parts of the world extensively, the United Kingdom, Brazil, many other countries. So, I think hopes are high that they will be able to complete their clinical trials, get their FDA authorization, and really bring hundreds of thousands of doses a week, or millions of doses around the country to bear relatively soon. And so, what am I hearing about that? I think end of March, early April is probably the timeline we're looking at for
all of 1B?
No, sorry, for AstraZeneca
Okay, all right.
and Johnson & Johnson to get through clinical trials, FDA authorization, and distribution.
So for all of 1B, what's your best guess? That's an impossible question.
I think that
June, July, what are we thinking?
that feels like a reasonable time frame. June, July, given what we're seeing in terms of vaccine production and what we're hearing about the potential for more, June, July would be a good bet.
Okay.
Amy, I can show slides on those doses numbers and so on after you leave. So
Excellent. So I know, Dr. Villa, you have to go. Just to see if any of my colleagues, delegates Hope Sullivan or Lopez, have questions specifically for you, Dr. Villa. If not, I'll get right to Dr. Varghese.
I've got a bunch of people, Dr. Avula, who are medical professionals and interested in helping, whether it's through the Reserve Corps or some other way. What should someone with medical training do to help advance this?
So moving forward, right now we have 105,000 doses a week. There's way more capacity existing in our community to be able to get vaccine out than we can possibly feed, right? I mean, honestly, if we could get to 40,000 doses a day easily if we had the vaccine, given the outlay of health systems, providers, pharmacies, and health departments that are churning vaccine out every day. So it's not that we need vaccinators as much, although the caveat I would provide is that in certain parts of our state, kind of the Petersburg, Emporia area, Crater Health District, and maybe a couple of others, there may be a need for more vaccinators. And in those areas, I would absolutely encourage you to sign up through the MRC. We've really tried to streamline that process where at this point, all it requires is a 45-minute orientation online, a skills test to show up, and a background investigation that turns around in about 2 days. So that's what the state MRC directive has been, to really try to get folks through the MRC more expeditiously. And then I think what we also need as we look forward to a time where we have much more vaccine is for those private providers and those pharmacies to kind of work through the CDC process to become approved vaccinators. And that's been happening at a pretty significant rate. At this point, we have 400 or so pharmacies that have been approved. And then about out of the 3,800 providers who expressed an intent to become a vaccination site, about 2,000 of those have been approved and are ready to receive vaccine. Now, that's a frustrating place for a lot of people to be, because they're like, hey, I've done everything you've asked me to do. I want to vaccinate, but there's just not that much vaccine to go around. And maybe one more thing I'd say about that ultra distributed model, I think, is needed at some point when we have really high supply. Right now, it has become a bit of a problem to ensure in terms of ensuring data quality. I think the states that have had really good success with administration and getting a high percentage of what they've been distributed out. Texas is probably the best example. A really focused, centralized approach. They're up 50-60% of their doses administered, and it's harder to do that because what we're having to realize now is that vaccine has gone out to so many different outlets, and they're all using different systems, not all of which are talking to our state database. So I think in this current period of time, we're going to stay a lot more focused in terms of where vaccine is going, but we need providers to come alongside, for the time when we have more vaccine.
Thanks, Doctor. Thanks for being here.
Thank you, Dr. Avula. I know you have to go on your way, and actually most of the questions are for Dr. Varghese. So thank you, Dr. Avula, for your hard work. Try to get some sleep, at least 2-3 hours a night would be nice.
Not what it's been. Thank you.
Dr. Varghese, welcome, Director of Arlington Health Department. Most of the questions are directed at you, sir, and a lot of people are quite upset. Got to be honest with you here. The big question of the day is what the heck happened with the Virginia Hospital Center? Why did all these people make appointments and then suddenly have them canceled? Why did it happen, and what can Arlington do about it to get those people rescheduled? So with that tough question, welcome to our forum.
Absolutely. Well, I'm going to ask you, I have a few slides I'd like to
Sure.
put things
Please,
into
go ahead.
context.
Go ahead.
Because Dr. Avula had a lot of things to actually talk about. And so I'm thinking, all right, it's saying I am unable to share post-disabled participant sharing screen.
We want to make sure there. I think you can do it now. Try now.
Thank you. That just worked.
Okay.
Need to. I don't know why I'm not seeing that's, hang on, I just want to make sure I get somehow, suddenly many slides were added. Okay. My apologies. All right, for some reason I added several slides, but I can still do it. I will just get to the right slides. Okay. So hopefully you're seeing a slide that says phase at-risk populations and essential sector workers first.
Yes.
Good.
Yes.
Okay.
See this slide.
So just to make sure that people understand, first of all, what Virginia has done, and we'll repeat a little bit of what Dr. Avula said, but I want to make sure that everyone understands what we also are doing in Virginia and in Arlington. So the CDC made recommendations on priority groups, and the way they did it was first by those who are at risk for complications versus those workers who are at higher risk for exposure. That was, if the entire purpose was, if there is actually limited doses, that was how they wanted to prioritize. So phase 1A, the at-risk populations were those who were long-term care residents, those living in skilled nursing facilities or assisted living facilities. And Dr. Avula mentioned that that is actually through a federal program that the states all are participating in, either CVS's or Walgreens, providing the vaccines, and that's where some of the vaccine is currently locked up, even though they're for Virginia, they may not all have been delivered. Then there's also the healthcare workers. We have largely left the long-term care facilities alone because until CVS and Walgreens are done with wherever they are, we can't do more there at the moment. We moved into 1B as Northern Virginia on January 11th. And the other part of the state that did was mostly Southwest Virginia. And at that time, it was 75-year-olds who were the at-risk population or older, as well as corrections and shelter residents were the primary groups in that area. On the essential sector side, and each semicolon literally is the priority order that Virginia has said. When you have limited resources, you first offer it to this group and then keep moving. So the first group were police, fire, and hazmat. After that was corrections and homeless shelter workers, and then childcare pre-K through 12. All the areas in green are technically where Arlington is. What we did when we moved into phase 1B, and that's why we have an MOU with the Virginia Hospital Center on before the 11th, they agreed that they would see the 75 years and older as the group that they would provide support to the health district at that time for 75 years and older. In that week and a half, we've now only had 2 weeks in phase 1B. Some of the things that changed were we went from 2 regions of Virginia in phase 1B to the entire state going into next week. And as you know, Dr. Avula just talked about, the state's only getting 105,000 doses per day. What the shaded areas are also indicating which groups were added to that. The 65, as you said before, and 18 to 64 used to be in 1C, now they're here. So And they also moved from 1C, the continuity of government staff, which is actually includes all of you in this region in a sense, because my county board, my county manager, most of my colleagues in Arlington, the judges and so on, none of them have gotten it yet because they're all in this group. And so this was moved from 1C to the end of 1B. So that's the other piece in this. There is actually a prioritization that Virginia actually said, this is the order. And given that each locality prior to this, it has different numbers. I used to be in the Three Rivers Health District, which is Northern Neck and Middle Peninsula. The number of police, fire, and hazmat there for 10 counties is significantly less than what we're dealing with here for law enforcement. We not only have the sheriffs and the police department, we also have all of the state law enforcement that work within Arlington. We also have the federal footprint as well. So people don't always realize that the size and scope of each of these categories is going to be different. Whereas for us, food and agriculture, while we have some, surprisingly, we do have some of those things, they're going to be much larger in other parts of the state. So that creates some of the disparities. And likewise, childcare and pre-K through 12 is estimated by the state to be up to 15,000 people here in Arlington. And when we invited the initial groups, that we were only had about 8,000 people that were on our list, the amount of demand led to the system shutting down. And so we've had to rejigger that. So there are just some of those realities. We wouldn't have detected that without that. So that is, in a sense, there is a prioritization scheme here. And then because of all this, let me point it out a different way to help people understand what happened this past week. Hopefully you're seeing Virginia getting 110,000 doses per week at present. I need to now change it. He said it's 105. So there were 3 different types of allocation patterns. Dr. Avula already talked about the federal pharmacy program. They initially allocated a lot more doses to the healthcare systems, including groups like Inova and Virginia Hospital Center and their populations. And then there were the geography or locality-based populations that like health districts would deal with. Through last week, all of these were still being done. What the state essentially said, as Dr. Avula just talked about, because there's so few doses, if you balkanize the doses, you actually make it harder for people to find out where to get vaccine. Imagine if you're a 75-year-old having to figure out, do I have to call Safeway, Giant, this provider, that provider? Do you have 10 doses of vaccine? How do I get in? We made the decision early in Arlington that we would always do larger things. So we've actually had the capacity to do more than 1,000 or do 1,000 per day, but you have to have vaccine to be able to do it. Going back to the slide, so people hopefully are reassured with the doses we get, we've received 5,100 first doses through the end of last week, through Friday. We actually administered 4,560 doses at 89%. And that means we have 500 doses available for our clinic starting Monday and Tuesday. We always want some vaccine available so we don't do what happened this week where if you don't believe you're going to get enough vaccine that you cancel clinics. So this change in the system, going back to this, Virginia Hospital Center was getting about 2,000 doses from the state on its own for its clinics, and that's how it was operating, even the center at Walter Reed. When that could no longer be assured, the entire allocation for Arlington, however we did it, was now 2,750 doses. When you combine what we were doing and the hospital was doing, it was 3,200 doses. And they needed an assurance that they would get a full 2,000 doses, otherwise it wouldn't be possible for them to honor their commitments, and couldn't just turn over all the doses and then cut out essential workers. So they let us know that it was not something sustainable because of this. So that's what happened. What we're trying to do, they've turned over their list of 75 and older, because that was the group that we had asked them to work with. So we've gotten about 3,000 names, and what we're going to be doing in the next several days is actually to look for how do we schedule them into our existing system so that hopefully within a week we'll be able to put people into appointments. And what I told staff is we're only doing a schedule through this week, so no one has to fear that they're losing out on doses in next week, to buy us a little time to get those individuals started to be scheduled into this. This is not an easy thing to do because the hospital system data does not go into the CDC system. So we have to now refigure out how to do all of those things and get to the seniors, some of whom who do not have technology. So we may have to use phones rather than email and so on to register them.
So
So
Dr. Varghese,
I'm going to leave it there and let you ask questions.
yeah, bottom line on the cancellations, the state basically had given out vaccine to health departments. They'd given out to hospitals. Hospitals hadn't used all theirs as effectively, frankly, as you and other health districts have. So the state decided that we're going to do basically, apart from the long-term care facilities, we're going to focus on local health districts. So it'll all go through you, not the hospitals going forward. Is that?
Roughly, I don't want to mischaracterize in some ways. Some hospital systems, including ours, did a very good job, but they needed to make sure that there was one person or one group in charge. Doesn't mean it can't go there, but I couldn't assure 2,000 doses when there were other commitments as well. So that becomes really an issue when there isn't enough vaccine. How do you do this? So that's why I showed you we are doing it in that order, and we're not going on to 65 before we finish 75, because this sort of promising people, it was wonderful that the federal government said move people up into 1B. The problem is if you don't remind people, but the amount of vaccine is not there. So that's why I want to show one last slide, if you're okay with that. Hopefully you're seeing something that says Operation Warp Speed.
Yes.
Okay. So what people need to know is these were the 5 companies that the federal government actually said, if you get through the clinical trials, we will assure you the money to produce the vaccine. So what the federal government did, and I've updated it with some recent purchases, with Pfizer, they secured 200 million doses, Moderna, 200 million doses. These are each 2-dose regimens, so that's each for 100 million people. Johnson & Johnson is the company that has the 1-dose vaccine, 100 million doses. AstraZeneca at 300 million, 2 doses, and Novavax, 100 million. The problem is, because you want to do it safely and effectively, the FDA has not received an application yet from Johnson & Johnson, AstraZeneca, or Novavax. So all of these doses could actually be produced sitting somewhere. I doubt they are, but they cannot be used until they go through a safety protocol. So the FDA has approved Pfizer and Moderna, but these are the additional details. Initially, we only bought 100 million doses because that's what they thought. And that was to be delivered within the first quarter of 2021. And then they purchase additional, and so they are supposed to do it for the second quarter, and the same thing for both. So in one sense, this explains kind of why there is not enough vaccine in one sense. And at the end of all of this, we'll probably have way too much vaccine left.
So Dr. Varghese, for folks who registered with Virginia Hospital Center and then had their appointments canceled, I thought I heard you say that within a week or so, you'll be able to reschedule. I don't know, most of them, all of them. I don't want to put words in your mouth.
So we are looking at the data to see how many people are fitting into the categories. We did only said 75 and older. So that is our first commitment. Okay, there may be people in their system that were 65 and older or 18 to 64, but we can't start with those groups because they can make those decisions on their own. I can't do something that another system put folks ahead when the commitment we've made is we're following the prioritization schedule that VDH has said is the schedule. And to go to 65 before we've actually offered it to the 75-year-olds seems inappropriate. And we also want to try to enfranchise. We know there are probably more 75-year-olds who, because of technology issues or language issues, the county is trying to get systems in place to beat the bushes so that they can get into that group as well. So it
So if
goes
you're a
back to that.
resident of Arlington County and you're 75 or older, you are our first priority because we've done all the healthcare workers pretty much.
We have to do both groups. We're still doing childcare and law enforcement. It's both at the same time. We're trying to get the governor to make a decision of, is it still parallel, or are they going to say now one group's higher than the other? I still feel an obligation, if they made that one group is higher than another, that you finish the commitments to whatever you already offered, but then take on no more.
So
But-
equal priority is 75 and older, and the essential groups, people like police, personnel.
Yes.
And
That's, yes. So
and-
this,
how many folks are we talking about in just the over 75 and the essential workers in Arlington?
all right. So I'm going to put this back up just because I think it helps. So the 75-year and older group in Arlington, based on 2018 data, there are 9,800 individuals alone just in that category. 65 and older to 74 is 15,000. If you do 18 to 64 with chronic medical conditions, well, the 18 to 64 category entirely is 169,000 people. If 50% of them have some sort of chronic medical condition, we're talking about 85,000 people. So this still goes back to the math problem, but we're not worrying about these yet because we still have to deal with 75 and older, as well as in parallel, we've moved from police and fire and hazmat, although we get still some people coming through, corrections and homeless shelter workers. We've offered them appointments and they're waiting for appointments to open up. It's not like they're, when you only have, last week I only had 1,200 appointments. Now with more doses, I can offer more. And every time we offer more, the schedule fills up. And childcare and pre-K, at a minimum, it's between 8,000 and 15,000 people. And we know that there's a lot more interest. And those two first weekends where we did the 900 plus clinics, they were completely full.
So bottom line, based at the current vaccine rate, and we all hope that new vaccines will come and the rate will increase from the federal government, and that would be great. And we expect that to come. But based on just the rate at which you're getting vaccines now, when do you suspect you'll be done with 75 and older, police, fire, hazmat, corrections and homeless shelter, childcare, pre-K, basically the old 1B category?
Well, the 1B still has this other group here. So Delegate Levine, I don't make those sorts of predictions because I think the problem is that's almost like over promising and then under delivering, which gets people upset. So what we do is if we start even having inclination that uptake is reducing, we'll go to the next group. It may be initially food and agriculture if this is only a group of 500 people, okay? Because it all depends on uptake. So there's no quite perfect thing there. But if we saw a significant rise, I'd also start adding the 65-year-olds because it's, I'm trying to accomplish as much as I can in any group at any one time.
And we certainly don't want any wasted dosage. So if Arlington County residents, and we have more than 500 and actually many who couldn't even make it in this room today, they all want vaccine. Many are in these categories. Let's take 1B first of all, people who are 75 years and older or in these essential vaccines. If they're not signed up, they need to sign up with you, or if they already signed up with the hospital, are they covered?
Okay. So we have on our website the ability to pre-register, and what we did with the 75-year-olds when they pre-registered, we sent them initially, please don't do it now, we sent them the link to the hospital site. Same thing so on the essential workers, they don't do it individually. You actually invite the employers, and this is what we're supposed to do. So for example, our Arlington Economic Development Group is contacting all of the groups in the essential sector workers. So for example, they've contacted all of the grocery stores, told them, here's the format of information. Don't make assumptions. If your employees are considered essential in these groups, send us their names with their emails. Don't make choices for them and say, oh, only some won't or some will. You don't know if people want to tell their employers they're getting the vaccine. They send us that when it's their turn and we are ready to, we upload all of that information into the CDC system. They will get an email sent saying you can now register in that system. They will also separately get an email to schedule in our system because we don't have our clinic made public. One of the problems when you do that in the CDC system initially was you could come from Georgia if it was on the public site. And we wanted to make sure that folks in Arlington had the first crack. So this is part of the laborious nature of this, is that you're trying to both make it locally available, but the problem is it makes it very technology based, which can disenfranchise people, because if you're not technology savvy, then how do you do it? That's why the county is helping us try to overcome those things. But we didn't want to wait till all of those was overcome, because otherwise other places would get more vaccine if we're not putting vaccine through.
So if you're an essential worker, you'll get notified through your employer. If you're 75 years and older, and what should folks do? If they've already registered with you, they should just wait till you contact them. If they
Yes.
talk, okay. If they register,
And the Virginia Hospital Center folks getting their names, and so the county's figuring out how to reach out to them so that we confirm, but we have to connect it to the scheduling. And because a lot of these individuals needed help from friends and family to enter data into the VHC system, same thing's going to probably need to happen with these people into the CDC VAM system. So those are things that we just can't say it'll happen tomorrow. We've got to figure out those mechanics to make that work, because we do believe that's important. And as I said, I'd rather say, look, the earliest we're going to probably get people into is next week. But then once we do, we'll be able to commit to that and saying, if it's only 3,000 people, we'll hopefully go through it much faster than what we were hearing that it was 12,000 75-year-olds.
if folks have not yet applied and are in these 1B, original 1B categories, 75 years and older, or maybe they're not, their employers haven't applied, but they fit within these essential categories, what should they do?
Okay, so on our website, it actually has information for both. We tell people if they're in the at-risk populations for complications, there's a registration mechanism for those 75 and older, those 65 to 74, and 18 to 64. That's directly on the website. For those who are not in those categories who work in Arlington, we're asking them to contact their employer and show them the site, because we don't want each individual grocery store worker, because that's not how it's supposed to be done. We need the employer to vet, because we know there are people in Arlington go, you better make sure that they actually work here in Arlington. Otherwise, why is it going to a non-Arlingtonian who could use the vaccine?
And what is the website, please, doctor?
So it's, let me see if I can pull it up on the screen. Pardon me, it doesn't roll off the tongue. And I think I may be able to put it into the chat box once I move the material. Let's see.
Mark, may I ask a question?
Please go ahead. He's looking up.
Yeah, he's looking. Dr. Varghese, I'm looking at the chat. It seems we have every person who was registered at Virginia Hospital Center on this call. So could you just answer very directly, if you had an appointment at VHC and it was canceled on you recently, what should you do? Do you wait to be contacted, or do you need to re-register somehow?
Okay. So it's a little nuanced, because we only ask for 75 and older to be vaccinated through VHC. So because that's the priority group. So if they were registered as 75 plus, that's the group that we're first working on. If they have not registered as a 65-year-old in our system, they should do that on that website. Because I can't promise them that they're next in line, because there were a lot of other 65-year-olds who did not who had no access to Virginia Hospital Center, who, for whatever reason, and so that would put one group ahead of the other.
So if you're Virginia Hospital Center and you're 75 plus.
And an Arlington resident.
And an Arlington resident, you're in the queue, and Dr. Varghese will contact you. Someone from Arlington Health Department will contact you. You won't lose your place in line. But if you're under 75 in the Virginia Hospital Center, they should re-register with you on your website, Dr. Varghese.
Correct.
Right?
Correct.
Okay.
So
Over 75, you're taken care of. Under 75, you need to re-register.
Right.
All right.
Mark, you're taken care of if you've already signed up.
If you already signed up, right? If you haven't signed up and you're over 75, you need to sign up
Right.
on the website that Dr. Varghese is going to
I'm
be
going to hope, actually, I'm going to first, I
providing.
can't
to
believe I'm sharing how often I'm sharing, but it may be also helpful to let people see it. And
Might
then,
crash your website, but let's
that's
put
okay.
it.
So this is
It's arlingtonva.us/COVID-19-vaccines.
right.
I shouldn't
And
say
then-
dash, it's actually a slash.
And I will try to put it in the chat box, but what I wanted to be able to show people is, unless they've already moved it, see, they keep changing things. So, all right. So you will see at this point, organizations, that's not, all right. Organizations and individuals who qualify for phase 1A or 1B should click here. So there is the ability to, you'll see individuals in Arlington County who are not frontline essential workers in priority groups 1B and 1C, what they can do. Employers of frontline essential workers in priority groups 1A, 1B, and 1C. So it's ways so that, and when you look at the individuals, it actually tells you about pre-registration, residents 75 and older, residents 65 to 74. So this is on our website, and let me see if I can just go back to this screen, and I'll copy it. And I'm assuming if I put it into the chat somewhere, people will be able to see it. So I'm going to stop sharing. And
I think I got it. It's Arlington. I'll write it up myself. arlingtonva.us/COVID.
I just,
Oh, you just put it there. There you go.
yes.
Excellent. All right.
Well, it's at least to the panelists. I don't know if the public is seeing it. So
That's true. I think they can see it.
actually, I didn't do it for all attendees. So let me try that again.
Okay.
My apologies.
Yeah.
Okay.
All right. So the next question, sir. Some folks are concerned that non-Arlington residents who work in Arlington are being prioritized over Arlington residents. Can you answer that question, please?
Well, actually, that's entirely what we were discussing, that it's both right now. Virginia said it's both people living in those categories as well as essential workers in those categories. So by default, we know the majority of workers in Arlington do not live in Arlington. For example, our police force and fire department, most folks and our teachers don't live in Arlington. So they are actually in those essential categories. And until we're told differently, that it's residents versus, and I'd rather not get into a residents versus essential workers thing, because hospital members are not always living in Arlington, and we need hospital staff to be around. We need grocery store workers. So just wanted to point that out, that's why this was a decision made at a higher level. If I had to make it locally, I'd still say you need to figure out a way to do as much as you can for both.
Now, for folks who are under 75 or over 65, or 60 and 64 with special health conditions, the group of 1C that was later added to 1B, if they sign up, you are keeping a waiting list of them, right? You're not ignoring them.
Well, we're keeping them on a list, and then when they provide the information, it's their turn. We will upload their information, but it's going to be a while before it's going to get there. The reality is, I think people are thinking it's going to be tomorrow. And when I just told you that, as you know, if basically half of Arlington now is on one side, and if our daytime population goes up to close to 300,000 people, there's a lot of people in 1B. And this is not just Arlington. This is what's happened across the nation, which is why it should not, in my purpose, it should not have been said, move them up, because it was, I think, made people feel happy, but it's like, look, major disconnect. We can do 1,000 doses a day just by ourselves. With our partners, we should be able to do 2,000 per day, but because we know the hospital was able to do that sort of stuff with their own people, and with other volunteers, we are prepared to have our EMTs, our EMS folks, they've been trained to give vaccines that they can add to that load. So we've got the vaccinators, as Dr. Avula said, but we need vaccine.
So
It just
go ahead.
Mark, let me
Yeah.
jump in. And so basically, as a part of the President Biden's executive orders a couple of days ago, I mean, he's invoked the Defense Production Act to maximize the manufacture of vaccines and supplies. So the issue right now is the vaccine supplies are not getting to Virginia, not getting to Arlington. Right now, we're actually working at the federal level to rectify that and invoke the Defense Production Act so that we can get those vaccines created, manufactured, and in the hands of folks like you to help get them in people's arms.
We're hoping it won't take very long to do that, but I'll be grateful for whenever we get much more vaccine.
Doctor, once someone's registered with you, they're safe, they're in your database, you will get back to them eventually again.
That's the current plan. I think people get scared because they don't hear it's for a long time, because yes, but no, it's safe, it's in our database, and then we will upload them when it's their turn.
What if you've had a first dose and you need a second dose? Should they also just wait for you to contact them?
So we do have that registry, and so far the federal government has assured the second doses. So we're starting to schedule the, like we have some first responders and healthcare workers. It's starting to be 28 days now to be able to provide it, because we've only had Moderna. If we get Pfizer, it'll be every 21 days. So we're starting to schedule the second dose clinics for those individuals. So we would be doing the same things, managing first and second doses. So if we get to 1,000 doses per day at some point, half of those will be first dose, half of those will be second dose, because eventually, if there's a mill like this, that's going to be what you need to do.
Is there any chance folks can get vaccine from their doctors or CVS or Walgreens apart from you, Dr. Varghese, if they're an Arlington resident?
No.
Dr. Varghese.
Because we're not actually trying to like send it out to tiny little places. That's what some places in the rural areas are doing because they don't have enough vaccinators. But this sort of, if we send it out to various people, I mean, like the pharmacies have literally said, we can do 30 per day because they need the distancing and so on. Well, how do you know which one has it? Asking people to call up, it becomes a maddening frenzy to have to go find vaccine. So we felt it was better to make it centralized as much as possible. It just still doesn't increase the number of venues that you can go to or increase the amount of vaccine that's out there.
Dr. Varghese, would you clear up one more time, because I think there's still confusion.
Sure.
If you're 75 and over and your appointment was canceled at Virginia Hospital Center, you do not need to re-register. You will be contacted.
Yes, that is.
If you are in the 65 to 74 category and your appointment was canceled, do you need to re-register?
The hospital has only sent us the folks 75 and older. That was the group we had actually agreed to. So the 65-year-olds will need to register or pre-register because it's not their turn yet.
Okay, I understand there's confusion on the website because the website seemed to indicate you did not need to re-register in that cohort, but you're saying they do need to register.
It would be the safest way, because we're only promising the 75-year-olds and older, because that was actually what we had asked the hospital to do.
Thank you for clarifying.
One of the things that actually may be confusing for folks, because they had their own vaccine, they had the ability to schedule other people as they chose and their interpretation. So that's why it may seem like it's arbitrary, but the thing is, I have to be consistent for the health district. We said it was going to be in a certain order because it was the vaccine and to have the trust one way. The hospital system had their trust in a different way, which is perfectly reasonable. It's just now that they're not running it, I can't just suddenly honor theirs, because that may move so many more people up, including 18 to 64-year-olds, where others have not had that opportunity.
Doctor, is there any priority within the over 75 group? Are you prioritizing 75 with health conditions?
No,
So
It's,
first
that's
come, first
too
served.
difficult. That's too difficult to actually figure out. Because otherwise that would also happen on the essential workers level and, among teachers and so on. That there's really no national way. Like if we had a national healthcare system, it would be so much easier to identify this in so many ways. I'm not sure I agree with it. I'm just saying, I think people think we have much more data than we actually have at our hands. We had to literally look up lists of healthcare providers because the State Department of Health Professions wouldn't turn over those lists to all the health districts, which means that took time to find people.
Okay, still getting questions in the chat. Again, if you're 75 or over and you register with the Virginia Hospital Center or with the Arlington Department of Health, they will get back to you on your appointment, and you think that'll be within a week or
So
two?
you combine two things that are different.
All right.
All right, that's why be very careful. There are people who pre-registered in Arlington who we sent the link to. All we're promising at the moment for those who were successful in getting an appointment at Virginia Hospital Center, 75 and older, when we get those names, we're working to get them appointments. Every other 75-year-old should be in our system so that we can start offering them appointments as well. But remember, we were not going to start 75 at all because it was going to be Virginia Hospital Center. We now have to incorporate 75-year-olds, so we'll start with the group from Virginia Hospital Center. However, if this is the platform, if anyone who hasn't registered in our system, please do so we'll know that you're interested, because that's the greatest way for us to know if you're interested in getting vaccinated.
Dr. Varghese, is there like a Q&A posting where a lot of these questions could be answered and clarified?
They are working on adding more of these because
Okay.
they've been doing it. This literally started Thursday
Sure,
to try to
I
figure it
understand.
out. So the county is working on actually trying to get as much clarity as possible. I realize, and so I'm not surprised. Not offended at all that people are asking questions. This just came out of the blue, and I'm hoping that this will provide stability for several weeks to come. I hate to hear if there's even further declines in vaccine, because then that means if we've committed to appointments, we may have to cancel them. Not saying that we're doing it. I'm just afraid we need to make sure people's expectations are always that let's pay attention to the news. And God forbid there's a further decrease in things, these things happen. I'm hoping that that will not happen.
Dr. Varghese, can you just speak to what's being done to reach out to new Americans and Latino populations in Arlington, and specifically in terms of translation services?
Good question, Delegate Lopez. The county communication staff has been using all its venues to get information out, whether it's on testing, now with vaccination, to try to enfranchise more people. They've also created similar to the Complete Count Committee for the census, they're building on that success to actually have a complete vaccination campaign. Some of the same people are part of that, and they're working to use those resources to get vaccine messaging out, both for vaccine hesitancy as well as information about how to get vaccine when it's their turn and so on.
So one question was asked, how many of the panelists here have received a vaccination? I have not put in my name, frankly, because I think there are people that are in greater need that it looks like my other delegates are.
I have not, no.
Right.
Dr. Varghese, can I try one sort of super question? I think you've said this, but this is also complex. 1B is a huge category of people. If someone is in 1B, they still need to understand that they will be served, I'll say, vaccinated in a cascading descending order.
Correct.
So if you're on the general list for 1B, that does not mean you can sign up and expect a vaccine next Thursday. You're going to be doing this running down the list. So in other words, if you're at the bottom of the list in 1B, you're still a long way away from getting a vaccine.
Unfortunately, you're quite correct.
So how many vaccines have you administered in Arlington, and how many have you gotten, and how many are you getting a week?
So I will put that back up. That's just so that people can see it. Was why the slide was created. So I'm hoping you're seeing something that says that's that phase chart at the very bottom. It talks about the first doses we received. So we received our first doses the week of Christmas. Through Friday, we received 5,100 first doses. Of those, we've administered 4,560, which is just shy of 90%. And that leaves us with enough doses for the first 2 days or the first day as we increase our vaccination. This was for a schedule of roughly 1,200 doses per week. Some weeks were better than others, but now as interest has grown, and we are supposed to be receiving Monday and Tuesday a total of 2,750 doses. So we're increasing the number of slots to roughly reflect that. So we're hoping to have the same throughput. And we believe that with all of the interest that's out there, we're going to see all of those slots taken.
So 90% of the vaccine you've received has already been put in people's arms.
Correct.
And you've scheduled more than scheduled the remaining 10%, and there's more vaccine coming. One of the questions we had in our Alexandria town hall is what happens if someone doesn't show up for a vaccine, someone cancels. We want to make sure none is wasted. What Alexandria does is they give it to police, public safety officers first. They call them in so that not a drop is wasted. Do you have a plan for when folks cancel?
Yes. Well, first of all, it depends on also if they cancel in the right amount. And we have had very few cancellations. There's no wastage, or if there's no extra doses, well, then there's no wastage. If there's even the risk of that, we then, we know, for example, in our building, we have people who would fit in one of the later categories as continuity of government, for example, or get more law enforcement in, and so on, so that we will get, no one should be in a situation where they have more than 9 doses at risk. We've usually only had 1 or 2 because we've had very little loss of people once they actually want the vaccine.
And there's been some question about that, I forget whether it's Pfizer or Moderna, maybe it's both. They come in dose packs of 5, but if you use the right kind of syringe, you can squeeze out 6 doses out of that. Have you been able to do that? Do you have those kinds? I understand there aren't even enough syringes to go around that can do that, but I don't know if you've been able to.
Well, I wouldn't characterize that way because I think it's not the right syringe. You're supposed to draw it up in the mLs that are supposed to be. I don't remember how much for each, but each of the providers for some reason have had slightly more vaccine in certain vials. And so they've said, if you can pull a full dose out with that extra, then use it. If you can't, they have said, do not combine bits of, like 0.2 here, 0.3 here from 2 different vials. They've actually said, and FDA agrees, do not combine those. So it's just part of the manufacturing process. They've been able to apparently get a little bit more into some of the vials. And so we follow those instructions, but we're not counting on it. That's why sometimes you'll see not quite a perfect round number because we may have gotten more doses out of something than we were supposed to.
One question that's been asked, doctor, is how those who are 75 or older but have no computer, how do they register? Do they call you? What happens?
So that's what the county is working on to actually figure out how to enfranchise those individuals and take phone calls and fill out the materials on the phone. So I don't have details on that. The county is working on that because this is kind of related to what we're going to do with the 75-year-olds who were registered with Virginia Hospital Center, because we know for a fact that a number of them got assistance from other people. So this is going to be a good trial run, but obviously they have to get that up and running. And so I'm letting the county work on those because the Department of Human Services often has that expertise, but they have to have more bandwidth with other staff from other parts of the county doing that. So those details, unfortunately, I don't have. There's no final plan, but they're working on it right now.
There's a lot of questions and I'm trying to get through them all. Some of these questions, I should say, there's some misunderstanding here. Um, Again, you heard from Dr. Varghese, 90% of the vaccines that have come to him have already gone out and the others are scheduled. It's not that there aren't enough vaccinators. It's not that we can't provide mass vaccination sites. It's just, we just don't have enough vaccine at this time. That is the overarching problem. You heard him say that if you're over 75 or in one of the essential groups, you get priority. And on that basis, it's first come, first serve, but everyone will eventually get it. Delegates Hope, Sullivan, Lopez, do you have further questions?
No, I don't. I mean, if you're going to conclude, I just want to say, I know that there's a ability to contact the Department of Health, the Arlington County Department of Health. You can contact my office, and if you're my constituent, I'll be glad to get those questions, send them to someone at the department, and get you some answers. We may have to do this again, Delegate Levine. I don't know, but I think we got to constantly communicate with Arlingtonians to make sure we get through this. Thank you very much, Dr. Varghese.
Doctor, I'm sure, like me, you can probably feel the frustration pulsing through the screen. And we have 444 people online, and there are probably 444 different variations of questions. I do think the county needs to do a better job of trying to answer those questions, or at least frequently asked questions, so that people can know what to do next. Like Patrick, for my constituents out there, feel free to contact my office. We will try to connect people to wherever they need to be connected. We're all frustrated, we're all anxious, and hope we can speed this up. My own personal view is there's blame at the federal level, there's blame at the state level, there's blame at the local level. We need to stop worrying about blaming people and figure it out and speed this thing up so that we can get to the end of this long tunnel faster than we currently are slated to.
So piggybacking on what my colleague said, first off, thank you, Dr. Varghese, for the amount of time and work you're putting into fixing this and helping everyone in the county. But the one thing that my colleague said, one word that's really struck with me is frustrating. We have been working with just countless constituents who are trying to navigate the system, trying to help their loved ones, trying to be as helpful and also to help their family and help their neighbors and their friends. And so please, if you have questions, you live in the 49th district, please do not hesitate to ever reach out to my office. We will help you try to get the clearest, most effective information you need to address the concerns that you have. But we are working diligently to, as Rip also said, do the positive work necessary to make sure that everyone gets vaccinated as quickly as humanly possible. And so, and that's at every level of government. And we're communicating and working with every level of government to make sure that we get more vaccines and that we are able to get those vaccines into arms as quickly as possible in Virginia and in Arlington. And so, but also, I also want to say, I think Patrick is right as well. We need to be, as more information is coming out, we will get it out through our regular channels, through the county and through the state. And also, we should be, possibly doing one of these again in the near future to just let people know if they have questions, there's a way that we can make this happen and get to the right decision makers like you, Dr. Varghese, to answer questions clearly.
Yeah, and I would just add, Dr. Varghese, if you need our help in getting the communication to our constituents, please let us do that.
Absolutely. No hesitation there. Thank you so much.
Likewise.
Go ahead, Mark.
Likewise, if you need information, if you live in my district, please don't hesitate to reach out. There were some Alexandrians I saw in the room. For Alexandrians, we had a whole town hall last week with Dr. Herring, who's the head of the Alexandria Department of Health. You can get that from my website, markfordelegate.com, or you can probably just Google it. We actually had a Fairfax town hall as well. If you've come in here and you're Fairfax, that happened today. Folks, we hear you. We know you're frustrated. We're frustrated. There's just not enough vaccine to go around. We wish there were. We wish our federal government had gotten it to us sooner. We do hope and pray that the new president will do a better job and get more vaccine out there so that poor Dr. Varghese doesn't have to ration it and doesn't have to only give it to limited numbers. There's nothing Dr. Varghese wants more than to vaccinate every single person in Arlington, but he can't. And it's not because he doesn't have the resources or the vaccinators. He does not have the vaccine, and you just can't vaccinate without vaccine. So they're doing the best they can. I know, Dr. Varghese, my guess is you haven't had a good night's sleep in about a year. I know you're working 7 days a week, and everyone on your staff is working very, very hard. Our greatest thanks to you. And, you know, to the extent that we can provide information, we will. I had someone write me the other day, you know, Mark, I know you personally, can you get me a vaccine? And the answer is no. I'm sorry. I do know you. You're a lovely person, the person who asked me. But no, we're going to go in order, and it's going to be the folks who are 75 and older and the essential workers. None of us in this room have had a vaccine. I'm not even putting my name in. Eventually I will. I want a vaccine. I assure you, I do. But until I know that it's available, and I would guess ask you, if you don't think you need it right now, to maybe hold back and let those who need it most go first. It's a hard thing to tell people. And obviously, if you have a tremendous health condition and you need a vaccine, absolutely sign up, get in line if you're older than 75. But all I can say is we went 10 months without a vaccine. It didn't exist. And we're just gonna have to wait a little bit longer. We have to keep wearing our masks, keep staying 6 feet apart. We're not out of the woods yet, folks. This is ugly, and it's more people are gonna die in America. I mean, let's just be really blunt. And I think it's gonna take probably till the summer. So all I can do, I hate to tell you to stay patient, but that's all really I can tell you. We don't have enough vaccine out there, and Virginia's going to work as fast as it can to get every vaccine out there to those who need it. Dr. Varghese, I'll give you the final word. Did you want to say something to end this?
First of all, my thanks to all of you and to everyone. Your passion and your desire for the vaccine is the right thing. I am so sorry we cannot solve it today, but also to Delegate Levine's point, vaccine is one of the layers, new layers of protection. Just after you get the vaccine, you cannot stop doing all of the other layers, because the whole world still has to get vaccinated for this to stop being a pandemic. All we know is that the vaccine reduces your risk for complications. We don't know yet that the vaccine will stop your ability to spread it to other people. So please get vaccinated and continue to mask up when you're leaving your house. But if you can, please stay home as often as possible and only socialize with those in your house bubble. There's just too many cases of COVID, and the hospitals are filling up. I don't want there to be a lack of hospital beds. That's not what we need at this point. Thank you so much for this opportunity.
Again, thank you to everyone. Thank you to my fellow Arlington delegates. We are all around to serve you and to answer your questions. And if we need another town hall next week, we'll do another town hall next week. But we want to make sure that you get the answers you need. Thank you, everyone. Thank you, Delegates Hope, Sullivan, Lopez. Thank you, Dr. Varghese. With this, I'm going to end.
Everybody stay safe.
Stay
Thank
safe.
you.
Mask
Thank you,
up,
everybody.
wash your hands.